So I'm going to call the meeting to order, and I'm going to begin with the chair's announcement. The Board of Health is recording. Is anyone else recording? Okay, then I'm going to begin the meeting. And Amy, our first thing on the agenda item is, do we have any public comments?
Does not look like we have anybody but us on the line. And if anyone is here and they would like to speak, raise your hand and Don Mackey will bring you in to speak.
Yep, I see nobody.
Okay. So then, Amy, I'm going to follow, have you, I don't have my
Sure.
document open with the agenda. If you can get us to the next one, which is, I believe, the minutes.
Approval of the minutes.
Okay, so just taking a moment to, just want to take another quick peek at it. I don't know if maybe, Karen, you have some thoughts or any changes to the minutes?
Oops, I do not. I'm just waiting for you to make sure that you've read them. I read them already.
Okay, give me 1 second and I'll
Yep.
let you know real quick. I have like 5,000 tabs open on my computer.
Kevin
Yeah.
made it.
Yay!
See?
She doesn't think so, but
Perfect timing.
yay! Did I know that? Yeah.
Perfect timing, Kevin. We're looking at the minutes. Well, at least I'm trying to find them on my computer. So if you want to take a quick look at them, we're just reviewing them. Karen already took a look at them. I have them in front of me now. And we want to see if we
Kevin
need to make
actually
any
can't
changes.
vote on them. He'll abstain because he
Oh.
wasn't at the last meeting. So
Okay.
it'll just be you and Karen.
Thank you, Amy.
I can't get the Brady Bunch picture going up.
There's the view on the right.
Up in the upper right, Kevin.
It looks like a bunch of squares. If you click that, it should bring us all up for you.
Says gallery view.
Yeah.
Okay.
All right, there we go.
Perfect. All right, I reviewed the minutes. I don't have any suggestions for any changes. Karen, do you want to make a motion? Okay, Amy, do we need to fully make the motion? Okay.
Oops, sorry. I'll make the motion to accept the meeting minutes from, what was the date on them?
October 6th, I think.
October 6th.
And I'll second them. And so we'll accept the motions passed.
All right. Good.
Alrighty.
The next item on our agenda.
I hate to
Kevin,
bring
go
it-
ahead.
Can I say something?
Yes.
Sure.
I did read the minutes, and the minutes that I had that were sent to me, it looked like I was present. It said I was present when I wasn't.
Oh,
So then let's make a motion to accept the minutes with that amendment because he definitely wasn't there.
Okay, I make a motion to accept the minutes with the amendment to mark Dr. Hinchy as being not there.
and I second that motion. And we pass that motion to accept the minutes with the changes requested.
Great.
Thank you,
All right,
Kevin.
so the next is to acknowledge Dr. Hinchy's service to the town of East Long Meadow by serving on our board. And it is officially, it's been 3 years now, right? This is the culmination of one cycle of our Board of Health in November. We are right on the 3-year mark. So I can't thank you enough for participating in this and being part of really the inaugural team. I mean, we've done a lot in 3 years, and I think I know you've added some really fantastic viewpoints and comments and service to all of this. And I personally thank you for all the things that you've taught me.
You've been to work with everyone.
Well, thank you.
Yeah, I have to agree, Kevin. I think I've been very fortunate to be on this team with you and Karen. So we're going to miss you tremendously. And having, our discussions and really thinking about how to move our community forward. when it comes from a public health perspective and the role that plays in the community. So grateful to absolutely have started this journey with you and Karen in these past 3 years. I agree, Amy. It's been a really interesting and transformative experience when it comes to thinking about how we've all played a role, and your contribution has been essential in the expertise you're bringing to the table and the passion you have for this work. So grateful to have been able to start this with you and Karen.
And I'll just add my two
As I
cents.
said, I've loved working with all of you.
Well, Dr. Hinchy, I just wanted to say I appreciate you being part of our board, and the what you bring to it is always that viewpoint or that thing that we did not think about or anticipate. And I appreciated that, because sometimes we'd be going a certain way and you'd bring up something really important and you take us off in a different direction. And I really, I appreciated that about you, and I'm going to miss you.
And, I'm
Well,
sure
thank you,
Karen,
Sarah.
who's speaking? Oh, I'll go. I'm sure Karen can speak to this, but we've both been involved in previous boards of health where there has been Karen not on the board, but working with the board, where there's been much dissent among the members. And it looks like Kevin might have dropped. It seems like he was having some internet trouble.
Yeah, I know that he wanted to make a comment, but it sounds like there was a poor connection, so I'm sure he'll bounce back in.
Here he's back.
This is our new reality in terms of working virtually, but it's all good. I think we've learned how to navigate these moments and being patient.
That and kids running around in the background. We've had a lot of that this week at DPH.
Nothing surprises me anymore. And it's all a part of our sort of our lives. So it's now more, I think, it's just part of the normalcy of this now,
Well, I think one of the things while we wait for Kevin is that this has brought health department to more people than it normally would have seen our meetings. And so if COVID has done anything, I think it's made the civic engagement process easier to attain. And when we have people engaged, it makes for a better community. So I think that's one of the positives that has come from COVID for sure. But Kevin is back. Were you going to say something, Kevin?
I keep losing it. No, it's good. I've loved working with all of you. Karen has challenged us as well. I think that this has been a great team, and that we all have the health of the city and
Oh, man. I want to hear what he has to say. All right. Maybe we'll go on for now. Oh.
We hear you.
You wanted to make this meeting interesting, didn't you? You said, I'm going out, but I'm going out with a bang. All right. I don't know if Kevin is trying to talk, but we can't hear him. Kevin, I don't know if you can hear us.
I can hear you. Like you said, I can see you and I can hear you, and you all are great.
Okay, that's really interesting, because every time he's about to say it, it gets cut off. Oh, this is awesome. He's coming back. All right,
All
Kevin.
right.
Go ahead. Well, we have you.
You all
all are. Did you hear me?
No, so you
No,
leave
I didn't.
East Long Meadow and you lose your Wi-Fi. You should move back. When you move into the far off regions of Western Mass, you don't have the luxuries.
Really? You hear me now? No, you can't.
Yeah, a little bit now.
Go ahead, try again.
I said a few things, but I'll just leave it at you guys are fantastic. I really have learned a lot by working with you, and I'm going to miss working with you.
Thank you,
Did you
Kevin.
hear that?
Yes, we heard
Yes,
that.
we heard
it,
that.
Kevin.
And wish you lots of
Okay.
luck in your new home.
Yes. And, all right. So the next item up is the Board of Health vacancy. So I was able to send around to Sarah and Karen. We did get one applicant, and thankfully, I think looks like a really amazing applicant with her experience. I don't know if any of you guys had an opportunity to take a look at her resume and cover letter. Some of the highlights are she has health promotion and health education background. She's worked in tobacco. She has worked in public health emergency preparedness, which I think is something really unique to Board of Health members because you don't really find that. She teaches at Springfield College, and I think her experience on top of Dr. McAdoo and Karen will be a great addition to that team. So Mary makes the official appointment, but at this point, what we would do is make a motion to recommend this if you liked her, and to make a recommendation to Mary as this is the board vote or motion on this candidate.
Okay, if you remind me of her name, because I don't have it in front of me,
Yes,
I would be
I do
happy to
have it.
do so.
Miss Johnston.
So I would like to recommend Ms. Johnston to be appointed to the board.
And I
And
second
I'm
that
making that motion, yes.
And I
I
will
second
second.
it.
Perfect.
Great. So
Excellent.
we can
Motion's
we can
passed.
pass that information on to Mary, and she'll make the final decision
Great.
from there. All right, Kevin, you can still vote. So did Kevin get a vote? I couldn't hear him if he did.
He did.
Yes,
I think he
I
did.
said yes.
Mm-hmm.
Yes. Okay. So Alex, that's three. Yes.
Mm-hmm.
I don't know. Maybe Alex is frozen too. We're having lots of technical difficulties. All right. So the next item on the agenda is the shared service update. I don't know, Sarah, do you want to start with your conversation with Mary?
Sure. One of the concerns that I brought to Mary's attention is in our previous discussion, we've had the issue of the shared services. The IMA had sort of been tabled for the last few months. And that was something that we wanted to make sure that we brought to the attention of the town council. And actually collectively, we had signed a letter to go to town council, but we had not heard from our town council president. We understand that we're in the middle of, go ahead.
I'm just going to let you know, Mary checked his mail and that he had not collected his physical mail.
Yes.
So that is why we didn't get a response.
Yes. We didn't have that information initially, but we have that information now. But in the middle of that, there's Long Meadow, really needs to move along in terms of making sure that they have their staff, for their health department, given that we're in the middle of pandemic. We didn't want to lose the opportunity to really continue to move forward on the initial recommendations that were made from that project. So I reached out to Mary to just talk to her about making sure that the town council is able to put back the IMA onto the agenda, and also to follow up with our town council president to make sure he did receive it. And that's when we found out the update that Amy shared. So I did re-emphasize that, I think it's really important for us to make a decision now. We're in the middle of pandemic. Not making a decision is a decision in and of itself. And it's really important for us to have open communication with the town council as well as with Mary in her role. And she was wonderful in having a really great conversation about that. And she actually moved very quickly to respond to some of the concerns that I raised about lack of communication, or I think what you pointed out, Amy, is with everything that's going on, some communication just didn't happen. With no specific intention, except that I think in the busyness of everything, some stuff got dropped. So Mary quickly responded by reaching out to the town council president, following up with Amy, and also connecting with Longmeadow. And that was just in the last few days. So we're happy that that's now coming back to the table. So Amy, I think if you give us another update to
Sure.
after that part, where we are now.
I can take you through this week.
I will pass the ball to you and tell me what's happened recently, but I'm excited to know that Mary has put it back on the table for us to discuss and to move forward towards the town council.
Yeah, so when this went on the agenda last week, the update was going to be very different than what it is today. Thankfully and happily, I had a conversation with Mary yesterday, and it's going to be on the town council meeting that's either going to be on December 1st or December 8th. We're unsure of the date yet. This will be kind of like the end. This will be like the final vote. We're going to ask them to either give it a yay or a nay at that point. Mary's been working diligently today. We've gone back and forth a few times with, an updated budget, and she reviewed the entire IMA from today and submitted it to Lynn. So we will have a final IMA to present to them, a final budget, and including all of the pieces that we've responded to of their concerns in the past. So I've asked Alex to pull a timeline together of the meetings, what was presented, what questions they had, and what our responses were. That way there's plenty of communication before the actual night, that if there's any questions or concerns, we can address it beforehand. And actually kind of recap it, because it's been over 2 years that we've been doing this, and we have new town council members, we've had a new town council president, so I'd like to make sure that we give them something that is digestible as possible. Longmeadow has posted for their health director, but in a conversation with Lynn yesterday, it seemed like she was willing to still have this on the table simultaneously to looking at the directors that come in. She has to move forward because her director is leaving in January, I think. So we'll be moving forward. It would be great if, I know Sarah, you've committed to being there, but Karen, if you could also be there. And Kevin, we would love to have you there. You'll be there in spirit to be part of that presentation on either the 1st or the 8th. I have asked Erica Piedad to also present, because I think there's a lot of movement on the state level to move health departments in the shared services, districts, regionalization realm. There's going to be a lot of finances behind that, and ensuring that health departments are providing equal services regardless of the zip code that you're from. And health equity goes into that, and there's just a whole lot of pieces that I think Erica Piedad could sum up really quickly, and also explain that there's money behind this. And I know a lot of times the state says there's money behind this and it doesn't come, but the reality is that this is where we're moving, even if the money doesn't come right now. The SAFE 2.0 Act was the first bill that was heard post-COVID. They had a public hearing last week. I think that says a lot. I think the senators and the state representatives that we have behind this are strong supporters of this, and she'll be able to sum that up in a way that is separate than the things that we'll bring to the table. I haven't got confirmation from her yet, because she actually had some surgery yesterday unexpectedly. So I'm sure she'll get back to me as soon as she's back at the table. And Kevin just asked what time on the 1st or the 8th, and it will be the meeting starts at 6 o'clock typically for town council.
I think, Amy, what I wanted to just share is in terms of one of the concerns that came up before is making sure we have accountability in that IMA, so that we can just monitor how things are going. You know, this is a new relationship that's setting the tone for how we're going to be able to work together. So that was a big part of the discussion, and we've built in there several meetings with a key group on a quarterly basis, and also a sort of review of some of our key progress that we'll be making. So there really is built into that the ability to be able to check in and see how things are going, so that we can address any issues up front instead of at the end of the year. And Amy, correct me if I'm wrong, I believe that the last time I took a look at that IMA, I think at the end of the first year, there's a sort of a discussion again around looking at the partnership to look at how that's
Yeah,
working
so the
and
first
moving forward.
year is kind of figuring out what's working, what's not working.
Right.
Is 50-50 the best approach? Are we staffed properly? And the first year we do have those meetings quarterly to kind of make sure we're anticipating those needs and addressing them as they arise. Making sure we've staffed properly. You know, we're kind of going at it with our best knowledge and what we think we're going to need, and we will be addressing it and assessing it as we go. But yeah, the first year is kind of that trial year, I guess, is a good way to put it.
Right. But I think what you mentioned is very important. In other words, we're paying attention to that. We're building into how the process is set up, and that we have representation from both communities to make sure that we're looking at our common goals and making sure that we're covering both communities. And that part is important. We're not overlooking one or the other, but making sure that it's balanced to accommodate whatever the priority needs of the community, because they may be slightly different. So we want to pay special attention to where the need is. And given that we're in a pandemic, that becomes even more important. And we could always revisit that if something has to occur much more often than quarterly, because when we were planning this, there wasn't a pandemic at that time. So paying attention to our, what's currently happening and making sure that we're keeping the community safe. The other part that I just want to mention that I know Amy has brought up before, but I want to re-emphasize, the reason why I also elevated this conversation is because in order to really be prepared to open up our schools and make sure our businesses can continue to function, we have to make sure that we have a strong public health response to this pandemic. So this relationship is helping us figure out, putting in there the infrastructure that we're going to need, not just today, but in the future. So it sets us up from a proactive perspective instead of a reactive, which is something that we discussed before. So all those things are to strengthen the way that East Longmeadow is able to respond to this pandemic, and making sure that we're meeting the needs of our residents, and also to make sure that our students eventually go back to school and our businesses will continue to thrive. So we want to make sure that we pay attention to that as well.
Right. The economy and our health are on the same parallel tracks. You can't have one without the other, and sometimes they're pitted against each other, especially right now for our governor in terms of which one is a priority. But really, for our community, we really need to prioritize both and focus on both in order for them both to be successful. So I think this is part of that movement. Any questions on the shared services or the presentation to town council? No? Okay. Covert Compliance. So the next item on the agenda, Sarah, is Covert Compliance. I wanted to let everyone know that Alex has been furloughed since March for 1 day a week, due to not having people come into town hall. In order to help save with the budget, people have been furloughed, but we've been able to bring her back to full time as a Covert Compliance officer. Donna has been doing her best to get to all of these calls and complaints and inspections, and it's starting to get to a point where she wasn't able to handle them all, and we had Alex in the wings ready to roll, and Mary allowed us to use some of the CARES Act funding to bring her back full time, help the department out with trying to get to all these calls and complaints. So Alex now wears 2 hats. And then finally is the COVID update. I'm going to pull up the data so I make sure we get it right here. It was all sent to you, but in case you don't have it in front of you, 2 weeks ago, 2 Fridays ago, the governor changed the metrics of how he was reporting the COVID cases throughout the state, and that color coding that everyone was using, the gray, white, yellow, green, red. And now, in order to hit those categories, you have to meet multiple thresholds. East Long Meadow is still rapidly increasing in terms of cases. Last week we did drop by 1 or 2 cases, but in the bigger picture, we're moving up pretty quickly, as you can see by the chart. One of the new threshold markers is our percent of positivity. And you guys all know what that means. But in case there's anybody who is watching who may not know what that means, the percentage of positivity means the percentage of all tests given that end up being positive. And in order to be designated a red community, you have to hit a 5% threshold. We far exceed the numbers necessary to be a red community. The first week we were at a 4.75% positivity, which is right under that 5% threshold. But thankfully, our community is all getting tested, and our testing capacity throughout the state is improving, and our residents are taking advantage of that. I think having those Stop the Spread sites in Springfield, our residents are really taking advantage of those, and they have great turnaround times right now. I'm seeing, a day and a half, 2 days. I mean, it's remarkably better than it was throughout the course of this pandemic, which is great. So we've seen our testing number even in the last, so 2 weeks ago it was 1,600 and last week it was 2,100. So I think that's a considerable jump just in that short period of time. I think because our residents are listening and they are getting tested, I'm not sure if we'll hit that 5% percent positivity. I can see what our trends are, but I'm not sure where our percentage of positivity will go as we move forward. We are still getting a lot of complaints and calls and inquiries. So the last time I updated on this, I did say they were all complaints, and I wanted to clarify because one of the things I think Dr. Hinchy asked was, what are the complaints around? What are people complaining about? And when I went back and thought about it, we're not getting just complaints. A lot of what we're doing and a lot of our increased workload is just the number of calls that are coming in. And those aren't necessarily all complaints, but they're questions. I've been exposed. Where do I get tested? How does this work? Who do I talk to? How do I get resources? So I wanted to clarify that they weren't just complaints. For the month of November, so we are, we're 17 days in. We've had 64, we'll call them inquiries, so far in November. Last month we had 87. So in the summer months it dropped down a little bit, and now we're seeing that pick back up. And then in terms of inspections and the number of inspections, Dawn has been adding to the normal, regular complaint-based inspections. So these are just COVID-related inspections. In the month of October, the final total was 21, and so far in November we're at 15. So we're there. A lot of our complaints are also coming in through the state. So it's not just our residents calling us. The state has an automated service. You can call and issue a complaint, and then I get an automated email. So we're getting complaints in multiple ways: our COVID hotline, our COVID emails, and the state. Sorry, you look confused. Do you have a question there?
No, I don't have a question. I was just waiting because I'm sure you might answer the question. Just I think more for public information in terms of what to do, a little bit more on testing, like where are you recommending that people go? And then, what happens when someone tests positive in terms of what resources are available to support someone staying at home and following through with, the recommendations.
Sure. Right now, we're recommending people use the Stop the Spread sites just based on the fact that they're coming back much faster than some of the other facilities that people are getting tested at. Also, you don't need a referral. You don't need an appointment. You don't have to have been exposed. I mean, really, it's they're wide open there. So that's where we send people. Eastfield Mall. Yeah, Eastfield Mall is the primary place that people from our area are choosing to go. We are doing a bunch of public health and outreach. Don Mackey and I have done 3 videos on LCAT around the emerging topics for kind of what residents needs to know over the last couple of weeks as it's been evolving. Alex has done a great job with our social media on Facebook and Twitter. And one of the things that we have found trending was that people were getting tested and then continuing to go out about life while they waited for those results. And so one of the big pushes that we had was like an education campaign around, like, once you get, if you get tested because you're not feeling well or you've been exposed to someone who has COVID, you should stay inside and quarantine while you wait for those results. Because you'll stop exposing people throughout that process. So that was one of the big things. One of the big challenges we're actually having right now, so we've done another education and outreach campaign around, is people want to do their own contact tracing. They are really reluctant to give names of their contacts who are close personal contacts and are considered close contacts for quarantine purposes. They want to do it on their own. So like businesses will say, oh, we've already let them know they're going to get tested. But one of the big gaps that we're finding in that is there's a misconception of like, yeah, they're a close contact. They work for my business. They got a negative test the day after they were exposed, so they can come back now. And so we're trying to do a lot of education around not only there's a lot more benefit to us contact tracing them than you trying to do it on your own, in addition to being what's required. But also they can't get services or resources unless they're listed as a close contact. So if you're a close contact and you need a return to work letter after your 14-day quarantine, we can't give you one because we haven't followed you. You're not linked to any case in our system. So really trying to help residents understand that no one's going to get in trouble. There's no like, you don't have to get the daily calls if you don't want to, because the CTC at this point is doing most of our contact tracing. I'm doing some of it. If it's something that needs to be done right away, like if we have a student who's in-person learning or a teacher or an athlete, I'll take those right away, make contact, help with the quarantining and the contact tracing, isolation. But the rest are going to the CTC. So we're trying to really help our residents understand that there's a lot of benefits to that. We did have 2 cases, which I found really interesting. So the CTC, one of the things they track is how many people have been requested the resource coordinator, so services beyond what normally is provided. And I was really surprised that we've had 2 people request resources. And they couldn't, but the problem is they can't tell you what resources they requested, because I was like, this is great data, right? If I know what resources are needed, even if it's only 2, that's something that we could put out some social media marketing on or do something on, but they can't tell you what resources were requested, which I feel like it's great to know that they're going, but what they need is actually what's more important to us. Sorry, you asked other questions. What have I not addressed?
No, I think you covered both. This being able to do this virtual, you said the silver lining is that people are able to hear this conversation. And I think it also provides an opportunity for some education, which is what you're highlighting, where to get the testing and what's the process. If someone, if you have to do the contact tracing. And I think it's important, as you were highlighting, being able to allow the proper system and process for contact tracing, because it's a wealth of information that is captured in there that I think helps us to understand the spread and like you said, the resources, although as you were saying, there's limited to what we get. But it's important to be able to, I think, address any misunderstandings or myths around certain aspects of, prevention and mitigation of COVID. Again, the more more information people have, the more we're able to mitigate, more that we're able to keep safe, more that we'll have a better likelihood of going back to school, going back to work, or continuing our businesses. So is thinking of this not only at the individual level, but thinking about it at the community level as well. So you covered everything that I just wanted to make sure that that's quickly reviewed.
And I have a great real life factual story that I think might drive exactly what you were just talking about home. So we were able to, there was a case that let us know right away who their close contacts were. We were able to identify them within 24 hours of exposure. And thus far, it's been about 16 days post, that person ended up becoming positive, 16 days post their positive diagnosis. And they knew soon enough that they were able to prevent their children in their house from getting ill by wearing masks and properly isolating within their home. And so that's a great, I mean, I tell them when I talk to them, because I say, this is fantastic. It's like, this is how it's supposed to work. Because if we can let people know as soon as possible, they're able to make different choices in their life, different choices in their home that then allow them to protect their families. It didn't, this person reported no like crazy challenges or hardships on them. They just wore masks. They did different things around their homes to protect their children. And so far, both of them have stayed COVID free, and they're now in, because of the way the isolation and quarantine overlaps when you're not able to properly isolate. They're now into their quarantine period and still are testing negative. So I think that's a really great concrete example of what proper contact tracing can do and why it's so important. You know, it's great for you to contact your friends and say, hey, I've tested positive, but if you follow the proper routes, there's just so much more that we can expand out and people that we can protect. So I think that was, thanks for bringing that up, Sarah, because that story I just love. And every time I talk to these people, I'm just so grateful for everyone who made that process possible, because, you know, we don't know always when there's someone in our home with an underlying health condition. And, you know, sometimes they're undiagnosed. And by sharing that information, you allow us to protect all the future people who may have been exposed by those people. So it just gets bigger and bigger by following the process. So I did want to share another piece of information that I also think is important. Is a lot of the feedback that we have been hearing is, you know, these are all the long-term care facilities. These are all the places where we would expect COVID to be happening. And so I have a little data. So far, just in the month of November, so we're talking 17 days. Oh, I lost the document. Hold on. I get all excited when we talk data. All right. So in the last 17 days, we've had 20 cases, 0 to 19. And we use 19 because there are some 19s that are still in K through 12 schooling. So even though it's not considered technically pediatric, I have included that in our threshold. Okay. And there are 50 cases in the 20 to 50-year-old range. And there are 22 cases in the 51 plus range. One of those cases is in a long-term care facility, and that just happened last week. And that's the first long-term care facility case that we have had in months. So I think, you know, if we're talking about having people listening to what we're talking about, I think those are important things, important pieces of data, that it is community-based transmission. And one of the things, going back to that family that we just talked about, one of the main sources of clusters that the state is finding is family-based clusters. So people who are exposed don't know they're exposed, they're living in the house, and then, you know, 2 or 3 people in their household become infected. And that, I think we can see in that 20 to 50 demographic, where you're seeing households or then the children or roommates start to fold into that.
I think you're bringing up something that's important during the holidays, and for our community members to sort of pause for a moment and think about how the holidays may be different. Hopefully it's only one holiday, you know, that we're going to go through like this, but sort of thinking about how to protect our family and our loved ones, that it just might have to be different for the reasons that you mentioned, because that is the way that, you know, a lot of the transmission is happening now, as people are beginning to change where they are spending time, but now it is the smaller gatherings. So, you know, any tips or any information that's is being released, you know, by some of the, you know, whether it's the CDC or other. I know you post a whole lot on social media. I see some of those tweets and information. So anything to give people tips and things to think about during the holidays about how to stay safe, I think would be helpful as a good reminder that to keep doing the right things that they have been doing. Amy, in terms of the long-term facilities and so forth, I know that you did a lot of education outreach back at the start of the pandemic. And it sounds like whatever they're doing has protected their residents from getting the virus. Have you had to do any additional follow-up or education or anything, or checking in with them, in any way, or they've sort of been just addressing it on their own?
Yeah, right now they're pretty self-sufficient. I think the state, they have resources that they can access beyond us now that they're utilizing. We do have frequent communication with Baypath because they have that remote, or what do they call it? It's not remote. It's like the commuter school in East Longmeadow. And so we've been working with Baypath for their college students, because it gets really tricky when they're from Connecticut, and it's a lot of communication and logistics because we have to make sure Connecticut gets that, because we're not allowed to follow them. But so far, the long-term care facilities are pretty much handling it. It's interesting because in April, May, that area, we had a lot of cases, but they were really focused on those long-term care facilities, which, because it was all new, it was a lot of work in discovering and trying to figure out the virus. But now that we're moving to more community-based spread, we're not dealing with just one director of nursing. But the impact on the department has actually created a lot more work for us, because each case you're dealing with independently and individually, as opposed to when you're dealing with a facility with 20. You talk to one director of nursing and you say, yes, we've separated those 20. Yes, we have these protocols in place, and this is how we're controlling it. But now when you look at 70 cases, what did I say? How many cases? 90 cases in 17 days. Like that's a lot of people to contact, a lot of contact tracing, a lot of questions to answer. And so it's made a difference in our department workload for sure.
Amy, I'm wondering, I have a really great graph that kind of is a great visual representation of the change in the demographics of cases. Am I able to share my screen for a minute? Because I just think it's important for people to see this.
Yes, Karen, you can share.
Okay.
Ooh, I'm excited.
All right. Are you seeing this now?
Yes.
So, I mean, it's just remarkable how it is flipped all the way around. So you can very clearly see that the age distribution of active new cases has completely kind of flipped to the younger crowd, mostly concentrated in the under 40 crowd.
Mm-hmm.
So, just to your point about a possible misconception that our cases are in the older population and in long-term care facilities, this is what they look like down here. So I know for me, I'll stop sharing now if you're all set. Are you all set?
I think while you talk, you could leave it up. That way people who are watching on Facebook can have a little bit more time to digest it.
Yep. For me, a visual representation really helps me. And I think if you're able to do some messaging around holidays, another thing that we're really hearing a lot about is this misconception that you can test into a nice, safe holiday. Just like you can test back to work and back to school. And it's not true. I mean, testing can certainly be part of a larger strategy. So for example, I have a student at college and she'll be testing before she leaves school to come home, and she'll have to test when she goes back as part of their bigger strategy. But that doesn't mean I'm going to be hugging all up on her when she's home either for the holidays, and she's going to be here for a very brief time, and we're going to follow precautions while she's here. I may have her masked while she's here when she's not eating, just because that taking that test it's a moment in time. And at that moment, you are not testing positive for COVID. That does not mean that tomorrow or the next day you might not test positive. So there's no such thing as testing into a safe holiday. And I think that's an important message to get out there.
Yeah, and to that point, the average incubation period time remains 5.1 days. So she could be exposed 2 days before she was tested. She
Yep.
would still be carrying the virus, not test positive for the virus, and then come home and be able to transmit that virus. So one of the
Correct.
key messaging points that we do, I've done it with Dawn and Alex has done on Facebook and Twitter, and actually that we all talked about today in planning, is helping people understand. They run right out and get tested. There's a lot of fear around this virus, a lot of like concerns for like immediate action, and really working with them to say, you can isolate yourself for 5 days, but don't get tested right away, right? Protect yourself, protect the people in your family. Even though what you want to do is rush right out and get tested to know if you're safe or your family is safe, waiting that 5 days will give you a much better indication about your positivity or not. And then also the same with that is if you are positive and you're trying to isolate with your family, after you come out of isolation and your family starts that 14-day quarantine period, they can get tested after that 5 days into that quarantine period. You'll have a very good idea about if they were infected during your isolation status. So I think that's a really great point. And Karen, one question on that chart, was that Massachusetts data or is that state data, national data?
It's Massachusetts data.
Okay.
So yes, Amy, those are all good. And this is a perfect example of why working with your health department as a resident is the way to go, because you wouldn't get, I mean, if you're told you're positive and you're going to do your own contact tracing, they're not going to get that advice that y'all just got from Amy. You're not going to get good, solid advice based in science, based on your individual situation. And that can make all the difference for what happens with you in your family. And, you know, we all have some challenging choices to make around holidays this year. And I just really beseech everyone to do your research and to listen to the medical experts. And there are things that we can do to protect our families. And the biggest part of that is really staying home and restricting your visitors to those that you regularly see that are in your bubble.
Yeah. Any more questions on the current COVID status in town? No? All right. Before we move to adjournment, I have been texted. Dawn, Mackie, can you bring Mary into the participant?
Yes, absolutely.
Thank
Sorry,
you.
I didn't see her there. Yep.
That's
She's on her
okay.
way.
Hi, Don, Amy, can you hear me?
Yep, you're
Yep,
on,
you're in.
Mary.
Okay, great. I only wanted to take a moment to add the official thanks from the town of East Long Meadow to Dr. Hinchy. I realize in the short time I've been in East Long Meadow, the significant effort that goes into these participation on these boards, and we're remiss in not recognizing that officially. So I'm happy I tuned in tonight because I wanted to meet you, greet you, and say goodbye to you all in the same message. But to thank you from the bottom of my heart and on behalf of the citizens of East Long Meadow whom you've served in such a capacity, a meaningful capacity on the Board of Health. That was it. Thank you very much.
Thank you very much, Mary.
All right. With that, Sarah, it's back in your court.
Yeah, no, I think that if we're all done, we can make a motion to close the meeting.
I make a motion to close the meeting.
Kevin, I'll let you
I
do the
second
honors. Perfect. Meeting's adjourned. Thank you.
All right. Thanks, Kevin.
Bye-bye.
Be in
Bye-bye.
touch.